We've got 14 children. Notice 50.
No, that's fine.
I give you the end.
If you guys joining can mute yourself, *6 if you're on the phone, it's the bottom left if you're on a computer. I still have somebody I still have somebody whose mic is on. The mute all did that. Yeah, but then you can just manually mute me. Yeah, I'd mute all and then just unmute. Me. Okay. Okay, welcome everybody to Supplemental Security Income. We have a couple of people in the room. We also have a bunch of people joining online, and all they can see right now is what you guys see behind me. So the microphone is right here, and just be aware of that for side conversation, moving around, and all that sort of stuff. So we're going to try this out. Let's see how this goes. I think it'll be fine. My name is Lisa Rosignol, and I'm the healthcare liaison and the Echo Clinic coordinator for parents reaching out. And today we're going to be talking about supplemental security income. This is a PowerPoint that we designed for families, but I think the discussion we're having largely here is about how to support families in applying for these so that we have kind of a basic understanding, even if we're care coordinators, so that when families are having these questions, we can be a resource, especially since they will be utilizing healthcare information a lot of times in this. So you guys can be a lifeline on that. There are also families who have issues of illiteracy, language issues that care coordinators, case managers, and service providers can support them in. So again, if you're joining us online and you have the ability, if you can enter your name into the chat function so that we can keep track of you. If you have any questions, there are question portions of this. If you can enter your questions into the chat function, we're going to keep you guys muted just to kind of keep down on background noise. And we'll read off your questions and answer them for sure. So let's get started. The first slide. Nifty arrow. There we go. Okay, so let's talk about the Social Security Administration, or SSA, is a federal agency. And the headquarters is in Baltimore, Maryland, and it provides support for over 60,000 employees. So we're talking about a gigantic system. So that's really important to keep in mind, the sheer volume of this juggernaut and bureaucracy. Most people access SSA through their local field offices. I don't know if y'all recall, but Congresswoman Michelle Lujan Grisham made a very well publicized visit to the office on Cutler, where people who were elderly or otherwise disabled were sitting out in the hot sun for hours and hours. And so the office was then moved downtown, which is a much nicer facility, moves quickly, but has very poor accessible parking, and it's hard to access in other ways. So, you know, we took one step forward, two steps back in some ways. But a lot of people in rural New Mexico are going to be accessing, and tribal are going to be accessing Social Security at their local field office. And you can find all of these online for them. There are benefits to going someplace online, going in person, because then they can make copies and you get a date stamp. So that's a benefit, because if you fax things, if you mail things especially, and it's not certified, you don't necessarily have the same type of receipt that you will if you physically get them to stamp it and intake it. I still have somebody not muted. Okay, perfect. Then next slide, please. And if you guys are just joining, if you can *6 to mute yourself on phone, or use the computer to mute yourself. And then next slide. She's not an IT person, so this is a big stretch for her. This is our executive director is posing as our IT person today. So the Social Security Administration administers 3 basic benefit programs, and we're going to just kind of do a primer on this because it's really important to understand. The pro staff got some exposure to this when we talked about Special Needs Trust. Joanna Baxter from the ARC of New Mexico came and talked to us about that. But it's important to understand because you might have somebody that has 2 or 3 of these, and so their numbers are going to come out. It's going to be very confusing. That one down. Okay, so the retirement benefit, so commonly called the Social Security benefit, and this is for people who worked and then they reach the age of 65, and I think it's like 64 and 6 months, something like that. And so they've paid into this account, and the amount that they get is dependent on how much they worked and how much they paid into it. And so that's the retirement benefit. So when we talk about the older folks that are, or the more mature folks that are at 65, they're going to get this. So you might hear them say Social Security, and that's going to be this benefit. The second one is called Social Security Disability Insurance, so SSDI. And this one and SSI get confused frequently because they have to do with disability. But this is for people who have worked and become disabled, right? And this is not for children. However, if there is a parent who receives SSDI, the child can be the recipient of SSDI. If they pass away or become disabled, they can be the recipient of both. And so what you'll see is somebody has a kind of a funny number that they get of monthly payments, and that's typically the case, that they're getting an SSDI payment and an SSI payment. And then the one that we're talking about and focusing on is SSI. So this is for families typically that have a child that is born with a significant disability, our low birth weight. So the preemie babies would also fall into this. They can qualify for this. We had a comment, let me see. Place. Okay, so somebody added, and Sebastian said, SSA retirement benefits only come in place at full rate now for people reaching age 66. It's pushing its way up to 67 month by month for each several birth year grouping. So that's good to know. So that's one of the ways where they're trying to make room for more people to get Social Security benefits for retirement, is they're backing up that age. So thank you for that, for adding that to the conversation. Okay, so SSDI benefits, again, paid, and it's called Title II in the regs. So we're going to be talking a little bit about the federal regulations and those terms so that if you run across those. SSDI benefits are paid to individuals and their dependents who have been employed and have paid Social Security tax. So when you see on your check, Federal Insurance Contribution Act, so FICA, they get a nice little healthy chunk out of your check, and that's why you're paying into this account. These individuals and their family members may receive benefits when they retire, become disabled, or pass away. So SSI is Title 16, right? Woo! SSI is funded through the general revenue of the federal treasury. And so this is why when we talk at the federal level, this is on the table pretty frequently when we're talking about it. To receive SSI, you do not need to have a history of employment or payroll contribution, and that's going to be most common with kiddos that have significant disabilities. It's a needs-based benefit intended for those who are aged, blind, or disabled. So there's a special class for blind, people that are blind, or who have little or no income and resources. So we're going to talk more in depth about this. There really is a burden of poverty on this population. So this notion that people that receive SSI are on the dole somehow, I mean, they're really living at the bare minimum of economic, resources. So the Disability Determination Services, the DDS, are state agencies that make the disability decision for Social Security. And in making a disability determination, the workers will request medical records, work history information, which is funny, right? Because if they don't work, but that's for like the SSDI too. That's part of how you show that you get the SSDI, is that you can show that you worked really well and then something happened and then you haven't been able to work for 6 months or so. And sometimes they actually pay for specific medical exams. We're seeing this frequently with the autism community. Where a child kind of falls on the fence and they can't make a determination if the child has severe enough limitations, so they'll pay for them to go to a physician. So it's no cost to the family. I think that there are feelings of mistrust about the doctors that are employed by SSA, and I don't know that they would be wrong necessarily, and I don't know that they would be right. But that's just something to know when you're working with families, that when they're going to see a doctor that's paid by SSA, they might be having feelings that this doctor, their whole goal is to make sure that the family doesn't receive government money. So that's just a component of it. And then SSA must periodically review the disability status of all beneficiaries and recipients. We see this in cancer because some cancers can resolve. And so some cancers, depending on what the doctors put the prognosis at, can really determine how this goes. Also, children with special healthcare needs, just because you have a diagnosis of cerebral palsy, that can mean a whole gamut of things. It can mean that a person has very little limitation, maybe has a weakness in the left side of their body, all the way up to somebody having significant impairment. So, and that can change over time. And then most people receive a continuing disability review. It's called a CDR. And so we'll get calls from families regularly on that every 3 to 7 years. Certain circumstances can trigger a new CDR. So if they get a job, if there are changes in income, if a caregiver passes, something like that. Next slide, please. SSI redetermination. In addition to the disability review, if you receive SSI, SSA will conduct non-medical redetermination to update your income, resources, and living arrangements. They do this typically yearly. And you'll get a letter that says how much money did you receive, and they'll give you the amount that they think they sent you and how much was used in the care of the person, and that's how they do the redetermination. It's also important to note that they will audit Social Security numbers at regular intervals. So we had some education bonds that we didn't even know we had. Somebody had purchased for my husband when he was born in 1976. That we didn't even know we had sitting somewhere. And SSA audited our Social Security numbers and found them. So we had to, because that's something that could be cashed out, we had to go track them down in West Virginia and find them and get them, and then lose our SSI for a while. But that's fine. We got some dough. So. In cases of dispute, the burden of proof always falls on the individual, and that's really important to understand. Individuals receiving SSA benefits should keep all paperwork. And so we teach a workshop called Keeping It All Together, or KIOT, where we give families a binder and we walk them through, because record keeping in all aspects of having a child with special healthcare needs is just paramount. It adds to our credibility. We teach families about keeping call logs, because the single biggest way that families diminish their credibility with professionals is being inconsistent and even hyperbolizing. And we all do it. I know I do it as a parent. We'll say, well, I called like 20 times. And they'll say, okay, ma'am, do you know who you spoke to? No, but I called like 5 times. Okay, well, we don't have any record. Okay, well, I thought about calling, but I ran out of time, right? So those are the kind of things where then we kind of diminish our credibility as a source of accurate information of how the systems were treating us. So it's really important to start talking to families early on about record keeping, filing, and that when we talk about the waivers, that we can be talking about keeping records for 10 to 15 years. And we've had cases where people have not done that. Up until this point, do we have any questions from the room, or anybody want to type them into the chat box? I guess if you don't have a chat function and you're on the phone, you can star 6 to ask a question. Okay, yes.
Can we get a copy
Of a kiosk? Sure. Or would you like to just come to a training? Okay. Okay. We're having a kiosk. Yeah. Yeah. So that'd be great. I believe so. Is it? Okay. Yeah. Okay, so we don't have any questions at this point. If you guys do, you can put it in. Does anybody else have a question in the room? Okay, so let's go a little bit more in depth on SSI, the application process. And this is going to be kind of the largest aspect of it. Go ahead and next slide. When should I apply for SSI? Whenever you have some spare time. I think this is all animated, so you can just click through. If a person is under the age of 18, the parent's income and resources will be considered. This is going to be different when we talk about waivers, but kiddos that are under the age of 18 are at the mercy of the family income, and that's important to understand. If a person is over 18, only the individual's income and resources are considered, even if they live with the parents still. And if they've been, and we'll kind of, let me just allude to this. If they apply, let's say they're 1, and they apply and they're denied for financial reasons, they need to start the process to reapply at 17 and a half for the 18-year mark. They can start the process at that point, so that the benefits can hopefully kick in by the time they're 18. And we'll talk what that looks like when they live with the parents, because you're going to want to charge them rent maybe. There are some things that we want to prepare people for at that 18 and that transition. But this is for kiddos that are under the age of 18. So a complete application for SSI cannot be done on the internet for children. It can be done for the retirement, it can be done for the SSDI, but for children, it cannot be done on the internet. So it's not enough to just send families there. They can start the application. They're going to get an error window that says this cannot be completed and you need to call and make an appointment. But it still submits it so that they have that preliminary information. Another thing that's nice about doing it online is if you have a family that does not speak English or is more comfortable in another language, the entire SSI website can convert to like 140 languages, which I didn't even know there were that many. If you click on the top, there's like a little globe, and you select what the language is, and it actually does convert every single word, including titles, everything to whatever language you need. So that's another benefit for them to enter that stuff online. But they under 18. You know, that's a really good question, and I don't know. I would be prepared for that. You could do it online, and then if you just get that error window, it'll give you the number to call to set up the appointment. The online application also, I don't think allows you, Wendy, does it allow you to upload the documents on that, or we're just doing the basic application? Okay. So, so when we talk about, they're going to give you either, so you're going to have to call anyways or go into the office anyways if you're out of a kiddo, okay? You're going to get assigned an appointment, either in person or over the phone. It is imperative that families make that appointment. No exception, be prepared. Because if they do not, they close the case. No questions asked, you're done for, okay? So it's really important to impress that upon them. Then they're going to ask for documentation, and the more documentation, the better. What has to come is that these people have to be citizens. So they do have to have a birth certificate. Okay, we do have to have, or a certified copy. In New Mexico, and I believe in other states, baptismal records, because they are treated the same, can also be brought. Social security numbers have to be. Now this gets complicated, my understanding is that the families do not have to be resident citizens, but the payer, the person who receives the money for the child, has to have a social security number and be a citizen. So that's important to understand. So sometimes people will have to choose a stepfather or another family member. If the child's a citizen but the parents aren't, they have to find somebody that receives the payment that does have a social security number. Other benefit inflows, so unemployment, child support, food stamps. Food stamps do not count against the income, but SSI does reduce the amount of food stamps. So that's important to understand when you're working with families, that it does reduce the amount of food stamps that they get. Bank statements, so 2 months worth of bank statements, because they're going to want to make sure that you didn't just have a bunch of money and put it in a coffee can and bury it in your backyard, right? They're going to kind of want to see what you've been doing financially so that they can build a case. Any wages, tax returns if you're a small business, 2 months of wages for any job that you have. If you've just started a new job, then a letter from an employer of what your salary will look like can often suffice. This is really important to understand too, that the New Mexico Center on Law and Poverty really want to impress upon us that they have to accept a personal statement of employment. So if somebody is like a migrant farm worker and they work off the books for somebody that doesn't feel comfortable writing a letter about their salary, they have to accept a letter that the person can write if they're not a citizen or if they're off the books, that can say, I, with the understanding that I can be that I could be prosecuted for providing false information in a federal proceeding, state that my monthly income is this or that. Because we do find that often where the child is a citizen, the family is undocumented, and they have no way to prove their income. So, rent mortgage payment. This is important. It doesn't matter what your mortgage is. We did have a case where somebody's mortgage was like obscene. I mean, it was like $5,000 a month, and SSI gave him, the SSA, the Social Security Administration, was giving him a hard time, and we just asked him to go back and say, okay, well, where's the regulation on how much my mortgage can be, right? It doesn't say. Like, if you have a $5,000 mortgage, you have a $5,000 mortgage. If you're in a living arrangement that you don't have, like you have something kind of informal where maybe you just slip your mom $100 a month or something like that, then a letter from your mom, whoever's the homeowner, will suffice also. This is the thing that is the hardest for people to understand and that gets them the most people denied and they don't understand. Stocks, bonds, burial funds, insurance policies that have any cash value, vetted amounts. So when you have a life insurance policy, amounts get vetted, so then you can access them at any time. You can cash those portions out. They're usually not a lot, but those are included in your formula. Anything that you can sell and convert to cash will be counted. You get one car per family. The second car counts as having cash value. So if you have two Escalades for $55,000, right, one of those is going to make a huge income ding on you. The largest thing that gets New Mexicans is land. I think everybody in New Mexico owns a piece of Cuba, and there's like nothing there. But everybody's like, I own Cuba. Land counts. What we see with the immigrant population really often is that somebody bought land for their family member who is undocumented, and they have a mobile home on there. That will count, because it can be sold. So those are things to consider, that all of those. And again, if you try to hide them, if your Social Security is linked in any way, they can find it, and they can penalize you, and they can make you pay back every penny that they've given you. And if they want to, they can also prosecute you for Medicaid fraud. And then your spouse's wage information if your spouse is working. So informally, what a lot of people do that have children with significant health care needs is they don't get married, because then you don't file taxes jointly and you don't count the two incomes. So that's one way that people are dealing with this. Or two people with disabilities that receive SSI or SSDI don't get married, because if two people that receive Social Security benefits get married, then their award or their entitlement is decreased by 25%. So there's actually a penalty to get married if you have a disability and receive these benefits. Okay, next slide. It's all really good news, right? I'm the bearer of sunshine and lollipops. But we have to understand this when we're supporting families, and I feel like probably everybody on the call and everybody in here understands that, you know, it's not enough to have a child with a significant health issue and go through all of that, that you really have to get pretty proficient in a lot of things very quickly, and it's tough work. And so we can kind of help and support and alleviate and leverage some of that. So should bring any documentation regarding the child's disability, especially IEPs, individual education programs from the schools. Include IFSPs, individual family service plans from early intervention, because sometimes they use different standards, and so the child might appear on paper more significantly disabled when they were younger. It's important to understand that this is a deficit-based system, right? And that we're going to have lots of time to talk about how brilliant and shining little Timmy is. But this is not the place. This is the place where we need documentation, and we have to show that this person has a significant enough disability to warrant the federal government to give some money, and they're going to make you work for it. So it's important to understand that. Names, addresses, and records of schools attended, including names of teachers and counselors. So when we do the kiosk, we ask families to start a folder for every school year that has the name of all of their therapists. And a lot of times you'll find this in the IEP, but it's nice to have that additionally in another place. You're going to want names, addresses, telephone numbers, dates of treatment records for all physicians, therapists, clinics, and hospitals. We even brought MRIs, because we have CDs of them. I mean, we really brought everything. And statements by relatives, friends, and other people who know you, your disability, and the obstacles you face. And so in this book, it's going to talk about what they're looking for. The congressional language, and for those of you who are on the call, we can get you a copy of this booklet that we have for families that's readable for different groups. And so what they're looking for and what the congressional language says is we're looking for severe and marked limitations, functional limitations that can last, that will last for longer than 12 months or can be considered to result in death. That's what the language is looking for. So they don't care, they're not interested in that little Timmy has a lot of different chronic illnesses or that he is the light of all of your life. They want to know that if he wasn't given significant supports from the family, that he wouldn't be able to survive, basically, is what they're looking for. So the statements from families and from we're doing a lot of coaching with families, especially with autism right now. Autism used to be a slam dunk for SSI, but now since we have the spectrum, we're seeing numbers of denials from SSI for autism around 85%. So we're actually kind of like assuring families that they're probably going to be denied the first time, depending on what their documentation says. If they don't have something that says that the IQ of the child is like 30 and, so on and so forth, we're just kind of preparing so that they're not shocked and they're not kind of bewildered. And then we stay in touch with them to kind of prepare them for what the appeal is going to look like. But the coaching is kind of like teaching families the language around activities of daily living. Like they know how to say, when I call little Timmy, he doesn't follow direction. Well, how is that different from a child who's also that age? That's a receptive skill. And how impaired is it? Is it that little Timmy never understands how to follow commands, or only when he's watching video games? And we'll have to kind of figure out how to articulate that to make the case that this kiddo has a significant communication issue. And so that's something that as care coordinators, case managers, you can have a dialogue with when you see the records. And when we talk to families and they say, well, he doesn't come, okay, that's a receptive skill, and this is where it is in the documentation. Individuals should apply for SSI benefits as soon as possible, even if all documentation is complete, because then you do have that option to appeal down the road. So getting started is a good idea, and it can take up to 6 months to a year. Next. If you call and indicate you want to apply for SSI, the date of your phone call will count as the official application date if the entire application is complete within 60 days of the call. So it's really important to pay attention. Almost everything is 60 days. And again, if you fail to complete anything, make a phone call in those 60 days, you're done. They just close your account, period. They do have forms within SSA that you can defer things if you have like extreme conditions, like if the caregiver gets really sick or something happens, but that requires you to call through and get a human on the phone, and it's very challenging. So if you're coming up on that 60 days and you're not going to be complete, I do encourage you to take the time to call SSA and try to find and see if you can defer or extend that period of time so that you don't lose your date. But I would just plan on making those dates instead. SSI benefits begin the first month following the month of the application. And this gets really challenging. So if I apply today, then my pay for July will result in my payment for September. So there's that lag. And that's going to get really tricky when we talk about payback. Because if you start making more money at any point, or if you fail to report your income and they audit and they look at it, then they can say, we overpaid you. In my family's case, my husband was self-employed for several years, and so we couldn't report our income until the February of the following year when we did our taxes. And we had a year, and we weren't really like understanding, and so we weren't like, oh, we can't make any more money, because we wanted to make some money, and so we wound up having to pay back an entire year of SSI. And we look at it as like an interest-free loan because they don't charge you interest, but we just went on a payment plan, and so we had to pay $50 every single month for like, I think we're on year 5 now. So, but whatever. I mean, that's what you do. So, so if that does happen and you do have to do payback, and then what gets really funny is I don't know what they do, but every once in a while SSA will adjust something in the formula or change over some computer system, and then you'll get a check for $2,000. And they'll say, we recalculated and we actually owe you something. And then you hang on to it because like 6 months later, then they're like, we overpaid you $2,000. So we're going to roll that into the one that you're already paying us $50,000. So, you know, again, anybody that says that people that are on SSI are just kind of on the dole and having a great time have never actually had to use it because it's kind of a nightmare. And when you are on it, you have to mail in your pay stubs every single month. And so it's important to know. And so some people get really good and some people don't go for promotions and some people change the kind of job that they have. Some people take demotions and they just get in the habit of sending in your pay stub every single month. It's what you have to do unless you're self-employed. And then you turn in your taxes in February and find out what sort of fiscal situation you're going to be in. You will likely receive a retroactive SSI benefit check when you first get started, because it takes a period of time and it'll go back to the first day you applied. So you can get a chunk of check. In some cases where we're going to be talking about appeals that go on for years, sometimes people actually get a pretty big chunk of money. But they have a period of time, I believe it's 9 months, where they have to spend it down because otherwise then it counts as income and then they can't keep their SSI. So. Okay, so the waiting period for eligibility determination is approximately 120 days. And they're running long because they're getting a lot of cases. So in New Mexico, they are reporting that it is taking long. Even they are getting letters that they're even having to delay beyond the 120 days because of a backlog. So if my child is denied, SSA has a process through which you can appeal. You cannot appeal if you are denied for financial reasons. So that's important. So if you have too many cash value assets, you're done. The good news is once they make it, if you're medically eligible but not financially, they keep a record of that. And you can go back and turn it on. So we had an experience where my child qualified medically, but we were both working, and so we didn't qualify financially, so they turned it off. And then my husband and I both got laid off at the same time. So we took our little pink slips over to SSA, and they turned it back on that day. And so like in a month, we got to start getting our SSI benefits, and then when we both got back to work, then we turned it back off again. So the good news is that as long as it's within the 18-year-old part is where it gets a little bit more funny. If you receive a denial letter, you have 60 days to file an appeal. And it's really important, again, to meet those deadlines. They do have that waiver hidden in there that you can extend that period of time if you have extreme circumstances. You have the right to appeal an initial determination made by SSA, a denial of benefits, a reduction of benefits, a termination of benefits, or overpayment. So you can appeal those and prove your case. It's really important and it's really complicated when you get the denial letter to look at the formula and make sure that the numbers match up. Because like we had an experience one time where for some reason they plugged in $10,000 a month into our formula, and so that was why we got denied. And it would be amazing, but we have never made $10,000 a month. So it was just a miskey, and that happens because these are humans in a big bureaucracy, and sometimes that happens. So sometimes the first thing we say is, if we got our Medicaid turned off for income, well, has anything changed? No. Okay, well then flip it over, look at the income report. Are you making that amount? That's usually the first step, and it's a fairly easy fix by going in or making a phone call. They can fix it usually that day. So next slide, please. Reconsideration. So this one, a hearing is gonna, let's say you get denied the second time, and then the third time is called a reconsideration, and a hearing before an I don't remember these two. You remember, Wendy, reconsideration is the one where it goes in front of an internal panel. It's different than the appeal, I believe. Yeah, we don't either. Typically, they get it by the second, or they are convinced that they're not going to have a strong enough case. Especially with autism, we're seeing that where the family kind of says, I'm not going to be able to get any more documentation. And so if they don't fall into what the guidelines are, then they're kind of done and they feel like they've done it. But after the second appeal is when we ask families to reach out to lawyers. Most lawyers will not talk to you until after you've done the appeal, and sometimes not even until you've done the reconsideration. Lawyers won't help you at that point. Now, some people have feelings about SSI lawyers, and I used to, but then my sister-in-law became one, and I like her. And what she explained to me is she's like, I like justice, but I believe that justice is best served through money, through penalizing people financially. And so she said, so I hold that system accountable by going after the money. So lawyers, their whole careers are based on documentation and evidence. And the benefit of having them at that point is a couple of things. This is going to be long, and the endurance is going to be in the hands of somebody else. They legally cannot contract with the family to receive more than 25%. It's in the regs. They cannot receive more than 25% of that lump sum award that you get down the road. So there's a cap. So 25 is a lot, but a lot of times lawyers that do personal injury, they're 40 to 50% of the payout. So it's actually not so bad. Their whole job, they spend their whole career getting people approved by Social Security. So they have the benefit to review your materials, find holes, and guide you to getting the rest of it. So it's a good idea. But this can go all the way up to administrative law judge, a letter to the appeals council of the SSA, or a judicial review in federal court. So this can get very big, and it can take up to several years. So we really hope that we get it the first time, or we nail it the second time. And sometimes we do have to have conversations with families where we review the materials and we've just kind of gotten a sense for, I know how you feel, and that it is, but that your child does have a lot of issues, but they are not considered at this point covered under the population that SSI is intended to cover. Children with severe allergies are a population that really struggles in this, because the families have to strip out all of their carpet, they have to sit on concrete furniture because the kids have such severe allergies. They're most likely not going to be covered by SSI's definition because they're just kind of outliers. And so it's challenging when you have somebody with a rare issue. So, questions on that part of it? Don't cry. We can all do this. Okay. Go ahead. Yes. Okay. So our question is, what about custody and how does this play into this? It's a really good question, and I am not an SSA administrator, so I don't know if anybody else can fill it in. I haven't seen a lot with custody, but I think that what they typically do it is whoever files the child as the dependent on their taxes is the income that is responsible and will be the recipient of the pay, is my understanding. So so sometimes the judge has to arbitrate who gets to file the taxes and who is the recipient of the SSA, and that's how they work it out with the child support and all of that. But with income support, I know for sure whoever files the child as taxes is the recipient and the income that they count. Does that help answer the question? Okay, yeah. Any other questions on this part of it?
What happens after the window to appeal?
So the question is, what happens after 60 days when the window to appeal is closed? The case is closed, they're done, they have to start all over again.
Because I just had a family here, and they've been denied. How long has it been? 60 days? Yes? So then start all over.
Yeah.
New application.
Yep.
Process.
Yep. So you just lose that effective date. So if it's been 60 days, then it's not as big of a deal, although that's 2 months of SSI payment, and that could be helpful. But if you're talking about somebody who's embroiled in this for 3 years and then they miss a 60-day window, it's unfortunate. And it happens to people because they're having, just because you have a child with special needs, it doesn't mean that you don't get sick yourself, or, the economy doesn't tank, or, there's any number of things that can happen. So, having a support net around this is really important too, and finding allies to help you kind of walk through and organize. So, and that's something that we don't do often, but we can do. If families need to bring in their paperwork, we can kind of go through and help them understand what their paperwork is and get it organized that way. If you guys have the ability. The other thing that I have to impress upon people, make a copy of everything you give them before you give it to them. It's just imperative, and write on it what day and time you sent it in, because stuff just disappears. It just disappears, and so it's really, really important. It's okay to be, in this case, I think you got to just kill some trees, sacrifice their lives, for the betterment of whatever you have to do. And I think it's better to be a pack rat when it comes to this type of paperwork than to streamline. Because you just never know when it's that one piece of paper and you can see it in your mind, but they can't see it. So, any other questions? Okay, so we'll move on to the basics of SSI. It is also known again as Title 16. Oh, this is giving us, again, a repeat. So we already know this stuff. So people receiving SSI also receive Medicaid, and that's really important. And that's a lot of time the biggest benefit of getting it is getting access to Medicaid. For 2016, the federal benefit rate is $733. So that's the maximum amount that they can get for Medicaid. So if you think about that, they're going to have below $2,000 in total assets and earnings, and then they're going to get $733 to live off of. I mean, this is the basic, the bare minimum of what people can live on in the United States, and it's not expected to rise. If you're a couple receiving SSI, the SSI amount will be $1,100. So again, it's not $1,466, it's $1,100 a month because you get the marriage penalty. Okay. It's based on what's called the federal benefit rate and is considered the minimum amount that a person needs in order to live on a monthly basis. The minimum. So that means no movies, no popcorn.
Even to pay rent.
Yeah, rent. And they're assuming that you're going to be on food stamps, but your food stamps are going to be reduced because you're receiving this amount. Okay, so income, let's talk in depth again about income. Any income that an SSI recipient receives must be reported to SSA. So if somebody gifts you money, if you inherit money, it has to be reported. It can impact the eligibility for SSI and the size of the person's check. So you might get $733 one month, you might get $525 another month, depending on if you take a side job or something like that. It depends on the household, and it depends on if you're enrolled in a PASS program. But the total, do you know, Adam? How much you can earn a month?
No. That's pretty
CD waiver.
But we're talking about SSI, right?
Yeah. I think it's like $1,300, isn't it?
You
I
can-
knew it was 1,000.
Yeah, I was gonna say, I know it's way less, it's barely over 1,000.
Okay.
When do they start the drop?
Okay.
Yeah, fix the 733
Yeah.
after you make 1,000.
600.
Yeah.
So, and then we'll talk about PASS programs in a second that can give them a little bit of wiggle room as far as what they make too. So, unearned income is money that you didn't earn. So if they get SSDI, that's going to count as income towards the SSI. Gifts, child support counts as the unearned income, etc. Earned income is gross also. A person is expected to use his or her SSI to pay for food and shelter. That's what it's for. A person receiving an SSI report is not paying a fair share of the living expenses, then they get a reduction of 1/3. So in the case of when you have an 18-year-old, a lot of parents will choose to start charging them rent. And we say to kind of take like whatever percentage their room is of the square footage of the house and take that percentage out of the mortgage, and that's what you charge them. And so that's why in the 5,000 case, when the child's room was factored into it, it was like $1,200 a month, and they were like, no, we can't do that. But it can factor into it, and so that's one way to bypass charging the kiddo rent. And then what families do under the table, we don't know. So next slide. So example 1. Chip is living with his parents. Chip is not working, so his parents don't feel it's fair to charge him rent. His parents also give him food and do not receive compensation. Because Chip's basic expenses are being paid, SSA does not need to pay the full SSI amount. As such, SSA reduces his SSI by 1/3. He will receive $488 per month as opposed to the full $733. So that's a significant ding in how much cash. Okay? Example 2. Bella is living with her parents. She pays for her fair share of food. She pays for rent. However, her parents explained to SSA that they would charge a higher amount if the renter was not their daughter. SSA reduces Bella's SSI check because her rent is being partially subsidized. At most, SSI will be reduced by 1/3, but it may be reduced by a lesser amount. So let's talk about resources, which we can go through pretty quickly because we talked about those in depth. Resource restrictions. So to be eligible for SSI, a person must have less than 2,000 in resources, 3,000 if applicants are a couple and recipient. So they can't have 4,000. It's not double. They can only have 3,000. Exclusions to this is the personal home, 1 car, money in a special needs trust, which we had a workshop on last week, and we can do those again. Money sheltered in a pass, and so we'll talk about that. That's if somebody has a private business, they can build a work account and they can build capital in that business account and then pay themselves a salary out of it. Because if you have a small business, you have to be able to build capital to expand your business. And so, but you do have to register with SSA in a pass program, and you do that by contacting them. Money and equity in a self-owned business. So if the parents own a business and they have it in a business account, but you have to show that you pay yourself a salary and that you're not using that business money for anything personal. Retroactive SSA payments for a certain period of time. So you get a spend down period, and it's typically 9 months. And we recommend that you keep records of everything you did a spend down on. So people will do environmental modifications. They'll buy themselves an accessible van if that's what they need to. It's a good idea to use it for the individual, specifically for improving their access to the community and their quality of life. Okay?
Can you explain that special needs trust?
Very vaguely, because I'm not an administrator. What I actually recommend is, and they're available to do trainings, is Joanne Baxter at the ARC of New Mexico does all of the special needs trusts for the state of New Mexico. There are some lawyers that do it. I've seen some kind of bad stuff happen with some of the lawyers, though, because they don't really know what they're doing, and they wind up jeopardizing the benefits of the individual. So we got a training on it, but basically they're really for people that receive a large sum of money that need to shelter it for the individual, because you have to pay for special needs trusts because they're administered by a lawyer. And then the administrator of the special needs trust makes decisions for the individual about what they'll pay for. So they talked about like how sometimes people want to go to Nevada and have a prostitute, and then there might be conflict with the person that's the administrator of the trust saying, well, I don't think that that's a appropriate use of your funds. And so
that could be money that was left,
inherited,
right?
Mhm.
That's set aside for that individual, and this administrator gets to decide how it's spent, basically, is what you're saying.
Yeah, I mean, they can work it out and the family, but that there are times where there's conflict between the individual and the administrator of how they can use it. But it's intended for buying a house, going to school, going on a vacation, because all this other stuff we're talking about, they can't go on a vacation with it. So they could,
It has to be a lawyer that,
Well, except for
yeah, they have lawyers that work on them though. So I would talk to the ARC on them. And then we have the ABLE Act now, which we don't have in place in New Mexico, but she can talk to you about the ABLE Act. Some people really don't like the ABLE accounts because it's a Medicaid payback, so you can pay into it, but when the individual passes away, Medicaid gets paid back their lifetime usage first, and then whatever's left over can go to the sibling. So some people, and the special needs don't do that.
And if the child dies, what happens to them?
I believe it goes to the state, is what they said. It goes to the special needs. So
It does.
yeah, it goes to the state. And then they use it for individual. Typically what they use it for, like there's one that was a woman with Down syndrome. And so she left like a $3.5 million trust, I think. And so they use it specifically for quality of life grants for people in the Down syndrome. So paying for them to go to national conferences, environmental laws, things like that. Okay,
Yes.
any questions on this part? Okay, income that doesn't count. So again, the value of food stamps doesn't count as income. Income tax refunds don't count. Home energy assistance, so LAHI, based on assistance based on state or federal government, grants, scholarships, fellowships, or gifts used for tuition and educational expenses. However, be very careful with scholarships and loans, because we are under the understanding that you have to document that you used it for books, that you used it for travel to educational conferences, that you used it for tuition. Do not use it for home or food, because then it's considered sustainable income, and they will reduce your benefit. Okay. Food and shelter based on need provided by nonprofit agencies are also. So if you go to Roadrunner Food Bank, they're not going to count the suspected value of the food that you receive. So resource example, Jessica receives SSI. Her grandmother passed away, leaving her inheritance of $10,000. What will happen to her SSI? Any guesses?
She spends it all.
Okay, let's see. Keep going. If SSI does nothing, she will lose her SSI and Medicaid because she is over the $2,000 resource limit. Jessica can spend down her $10,000, or she can shelter the money in a special needs trust, which will cost money. But that's what she can do. Oh, here we go, special needs trust. A special needs trust preserves assets that would otherwise disqualify someone from SSI and Medicaid. And so there's the number for the ARC of New Mexico, and Joanna Baxter is your person. There you go. I put stuff in here that I don't even, look at how I'm informing myself here. Okay. I just came back from a month in New York.
Nice.
So
Were you?
Yeah. Yeah. And then ABLE account is something that Congress approved in 2015, Achieving a Better Life Experience. I don't remember what we call it, but we had to name it something different here. And so we do have the legislation to support it, but it's just not set up to include anybody yet. It'll allow families or individuals to save up to $14,000 per year, up to a total of $100,000 in a special account that are much less expensive to set up than special needs trusts. But a lot of people don't like that Medicaid payback.
So are these available in certain states then now?
Only in Ohio.
Wow.
And you can access them. You can set up one in Ohio, but they're the only ones that have all of the legislation and policy set up.
And that'll cover a kid here. Great.
Any other questions on this portion? Okay. And in the chat box, I didn't see anything. Okay, so earned income and SSI. If a person is working, SSI will adjust a person's SSI amount based on his or her gross monthly wages or parents if the recipient is under 18. And again, at 18, then parents don't count anymore, kiddo does. Parents or guardian for SSI recipient under 18 or person of SSI first begins working, she must notify SSA. So if little Timmy goes and gets a summer job, they need to notify SSA. The person, again, we talked about, will then be required to send in copies of wages and stubs to the SSA office every month. They did not tell us this. And you need to keep them because they lose them. They lose them. And from time to time, a year later, they'll say, we need all pay stubs from 2013. Keep all of your pay stubs. And sometimes employers will charge you for replacement pay stubs. So, you know, like I know somebody that works here that's been on SSA for a long time, and in her desk, she has a stack of every pay stub that she's ever received from parents reaching out. So.
Question. There's on high school where the kids help package some food and stuff, and they just started paying them last year for it. And they gave them 2 checks on first half of the year and second half of the year for $100. Now, do those kids support that?
I suspect they would, if their Social Security is linked in any way to it.
Yeah.
Yeah, and that's what, when we work with families and we want to stipend them, a lot of them wind up donating the stipends to us because they don't want to mess with this. They just don't even want to mess with it.
Could they just report it at the end of the year?
Probably, yeah, at any point they could, yeah. Like when the parents report their income, if they're under the age of 18.
Doing that report that the parents have to do, you know, once a year at the end, say how you spent the money and if they have any extra, what they have in space, whatever.
No, I would just send the stubs in with the parent stubs as soon as they have it. Whatever the stub of the check is, I would just send it in with the parent.
A lot of these kids are not with guardians.
Okay.
So.
And so they don't send in stubs ever?
Uh-uh.
Yeah, then I would go ahead and do that at the end and maybe send a copy with the letter report back. That's what I would try.
From what I understand, I've had some families who don't want to pay.
Right,
that.
right.
And what I was told is if it's under $500 in a year,
Yeah.
then it does not get it.
Okay.
So they should be fine. I mean, I would.
So would you send it in or would you not?
I don't think they need to.
You don't need to, as long as it's under 500? Okay.
And it's to the child, you know, check.
Right.
From the And it's only one class that they started doing it this last year.
It's weird. I can't, but don't hold me to that.
Okay.
It's just what I've been told to advise my families on who don't want to report that.
Yeah.
They're on.
Did anybody else online just get kicked out? I think a bunch of people just got kicked out. That's weird. Okay. That's not good.
Just that would be consistent with federal financial aid requirements as well, that if you're under 500, then it doesn't get to be reported to the child maker. So it
That's
seems-
good to know too, because several of them are also tribal members, and they're trying to give them $100 a year to buy their coats with. And so, you know,
So I'm gonna have to turn around and look. It's Zoom's been kicking us out from home. Okay, so I think we're good on that one. And you know, different people are gonna do different things. I'm a Chicken Little, so I report everything probably too much. I've had people say you report too much, and I don't know, because I'm not a good judge of that, so I report everything. Other people are gonna report even less, and they're gonna see what they can get away with. And I mean, well, I was gonna say the worst thing is that then you have a payback. The worst thing is being federally prosecuted. So that's the thing that I'm just assuming is going to happen to me. So thank you. Perfect. So it's really up to individuals of how far they want to go on that one too. So, okay, next slide. And then, yeah, put the social security number on every stub. They take the wage information and reduce SSI accordingly. The process can take 2 months. So again, the SSI amount that you get paid in December is based on your wages in October. So you can see things fluctuate. And sometimes you don't know that there's a problem until it's pretty late. The general idea is that SSI is reduced by $1 for every $2 earned. So that's important to understand when you're looking at I don't know what's happening. It keeps kicking us out. Okay, so by working and receiving SSI, a person receives more income than by just receiving SSI alone. So they do give them that. And let's talk a little bit about the work incentives, and it's called the 1619B. And the first one is the PASS, the plan to achieve self-support. Oh, I think I'm way past you. Sorry. It's a SSI provision to help individuals with disabilities return to work. And if you receive SSI or could qualify for SSI after setting aside income or resources so you can pursue a work goal, you could benefit for a PASS. So if it's like putting aside money to start a business, something like that, it gives you that ability to put the capital there. Enroll for that?
Yeah.
You have to contact SSA and they have to be enrolled into a PASS plan. Yeah. Probably. If you guys want to look on ssa.gov, if you just search when you get on there, PASS, it has a whole toolkit. And again, at the top, you can switch the language to whatever language you need it in. That's what I recommend. The SSA actually has really great resources. So even if after we talk about this, if you wanted to go onto SSA and search applying for a child for disability, they have a toolkit. They have lots of really great resources that are family friendly on there. And the benefit again is that you can convert everything to a different language. So. Okay, and we talked about unearned income again, SSI, inherit. Okay, so I got to edit this. Okay, so on to a quiz. Ready? Let's skip this one. Mr. Hawley doesn't know what type of SSA benefit he gets, but he knows the amount is $760. Does Mr. Hawley get SSI? Good job. That's right, because it's over the 733, right? Quiz number 2. Jess receives SSI and Medicaid and has recently started a job. His wage will be about $1,685 per month. What will happen to his benefits? Any guesses? Jesse will. Oh, okay.
It says he does not get SSI. Where does he get qualified for like SSDI or?
So he probably has SSDI, or he might even have SS retirement, SSR. He might have the Social Security retirement, but he definitely doesn't have SSI because we know because it's over the 730 date. Yeah. Okay. So Jesse will lose his SSI cash benefit, but will remain eligible for SSI and Medicaid. Okay. Number 3, Matilda, who is a transition student and an SSI recipient, lands a part-time summer job. Will her SSI initially be reduced? This one's kind of an interesting, kind of dark one that I didn't make up this question. It shouldn't, but you never know with SSA. If it is, then the SSA has probably made a mistake, which is likely. So you need to check it out, okay? Number 4, Boris, an 18-year-old who has never worked, received only $424 SSI a month and Medicaid. He's never been notified that he has an overpayment. Why is Boris's SSI less than his friend's SSI, which is $733 per month? Is it Boris gets less SSI because he doesn't have a work history? Boris probably isn't paying his fair share of room and board, or Boris is confused and actually receives SSDI? Middle one. Yes, ma'am. It's because he's probably not sharing his fair share of room and board, because that's a 1/3 reduction. And then quickly, SSI gives you access to Centennial Care. So they receive Medicaid, which is one of the biggest benefits. Although, if you're of an income level that you receive Medicaid, receive SSI, you would likely be just fine getting Medicaid through the Income Support Division because we have the expansion. So you actually would definitely get Medicaid through there. So, so it's not the benefit it used to be. It used to be a really big deal for people that couldn't get good enough insurance to cover the child because they made too much. And it is not the same as Medicare, and that's really important to understand. Some people that receive these benefits will get Medicare because they'll get the SSDI, and that'll give them the Medicare, or they'll be of an age, and so they'll have both of them, Medicare and Medicaid. But Social Security, or SSI, gives them Medicaid. And I don't talk too much about it. We have another workshop next week all on Medicaid, but what can I answer for you?
Well, my understanding is that the guardian or the parent signs up the disabled person, and we can pick wherever we want to sign it, like if we have United or Presbyterian.
The bump, Blue Cross, United, Molina, and Presbyterian.
And
No.
does everybody have any experience with one being better than at that point?
Yeah, that is probably because we have a bunch of insurance people on the phone. We probably don't want to do too much of that, but one thing to know is that Presbyterian and United are no longer participating with the University of New Mexico hospital, and so if there are some conditions where they can do a prior approval and let people continue seeing people within UNMH, but you would likely be operating outside of the UNMH system. So that's important to know. They're also, if you wanted to contact the Medicaid, the Medical Assistance Division, they have a spreadsheet that shows the value-added options for each of them. Yeah, and so, great, okay, yeah. So there are different member benefits for each MCO, and so some work better for others. Some have like non-medical transportation to the pharmacy as an added benefit. Some, the traditional medicine benefit is higher. So there's lots of different options. What we recommend doing is to going to your PCP and having them help you kind of assess your network and ask them which ones they're having the most success with.
The Presbyterian has become much more lenient about going out of the network because there are some services that they just can't provide.
Mm-hmm.
So you know, the alternative is to go to healthcare. So they used to be really much more rigid, but they're really relaxing. They just can't get professionals.
What we found too was if we transfer over from one insurance staff was to find out which one is going to cover the doctors and you with them, and which one is going to cover the medication she's on going to the medication. Because there are some doctors that No, that's
Primary care physician. I apologize.
Oh,
Okay, I'm back in now. All right, I'm back in. I'm back in the saddle again. All right. And Centennial Care can pay for personal care, you know, and again, we're going to have a workshop next week that we'll try to do in this format, and we can get you information on, it's not next week, is it next week?
Yeah,
Next Friday, the 10th to
Okay. Again, I'm not even here, and I booked all this stuff for myself. So, but it'll talk more in depth about how to do your health risk assessment, your comprehensive needs assessment, how to access those long-term services, and how to support families through those, and how to talk.
I'll confirm.
We'll
the
confirm.
time.
We'll confirm
Before
before
you
you leave. And those of you that are on the call or online, I'll probably send an invite if we do it in this format again, so you guys can attend. Okay. Let's move on. And so that was an hour. Some people might have to hop off at this point, but now we're going to talk about the waivers. So the waivers make Medicaid funds. So this is called Medicaid Part C. And this is going to get kind of messy because it's technological. Remember, there's a chick that used to say technological. So what the point of waivers were, so a little historical background. In the early 80s, a woman named Katie Beckett, I think she was in Iowa, wrote a letter to Ronald Reagan, and President Reagan at the time, and said, we want to be able to take our medically complicated children home. Because prior to that point, children that were born medically complex lived their entire lives in a hospital because they had a vent or a feeding tube or something like that. And so President Reagan started a task force, and they looked into, and New Mexico was actually the first state to create a medically fragile waiver. So this is for kids who lived on technology, so they had vents or things like that. And it allowed individuals to live in the community as long as the cost of wraparound services and supports in the community could not exceed what it would cost for them to be in an inpatient setting or in a residential setting, institutional setting. That's really easy to do because institutions and hospitals, you know, between the liability insurance, between keeping the lights on and all of the employees and all that stuff, it's just incredibly expensive. And so that's what these waivers are for. And so they provide monies to support individuals with a variety of, on a whole spectrum of needs to be able to stay in their community and live and be members of society. Okay. So let's start with the Cadillac, the granddaddy, the developmental disabilities waiver. So this is, and this is what we get the absolute most phone calls about, because people just have a kid that has any aspect of disability, and we have such a long wait list that people just tell them, okay, you better just get on this wait list. They don't even necessarily know what they're applying for. They don't necessarily know how their child fits into it. But it has two criteria they must meet. Is one, that they must be of have a medical qualification of having really what they want is a developmental or intellectual disability. So again, little Timmy might have lots of different things, might have ADHD, might have severe allergies, might even have a severe physical life-threatening condition. But if they do not have a significant intellectual or developmental disability rolled into that, then they will not qualify for this. So that's really important to understand. And then the financial criteria is similar to what it is for the Social Security, for the SSI. However, it waives the family's income and assets. So it's based on the person. So how much my 9-year-old makes right now is not going to be an issue, right? So she makes 0, and so she is eligible for a waiver. However, if we do our jobs right and she grows up and she goes and designs, you know, luxury cars because she has very expensive taste, we're trying to figure out what grad school she's going to have to go to buy the Land Rover that she wants, then she wouldn't qualify for this, right? There was a gentleman in town, Tim Harris, that owned a restaurant that was very, very successful. He was not financially eligible for the DD waiver. So because as a person, as an individual, he made that much money. The person must have developmental disability or intellectual disability or related condition. And we have a document that we can give you guys from, we have a larger book that's in editing, and we have a printout from the Center for Development and Disability has a really nice tip sheet that talks about those related disabilities. And the disability must occur before the age of 22. And actually, there was something that I don't understand. Maybe you remember, Wendy, that it has to be like documented by 18. You were hearing something funny like that. So this is not going to be for somebody that has a traumatic brain injury at 23 or even 22. Yes.
So I have, my son was born with an eye disease.
Mhm.
When he turned 16, he was documented, well, we had it documented probably when he was 10 at the Hershey Medical Center. When he was 16, we were in North Carolina and played with the military. So it was, you know, they checked his eyes and he could drive, but here recently in New Mexico now, he's legally blind. So the documentation that we have when he was 10, 11, 16, is this what you're talking about?
Mm-hmm. 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 Yeah, whatever makes a better case, you can use that too, because like we talked about, like some documentation doesn't make as good of a case later on too. So, but if it's a visual and not an intellectual or developmental disability, then this is not the waiver for it. Yeah. That can be included to paint an overall picture of access issues, and vision would be, you know, might be 1 or 2 functional limitations, but it wouldn't necessarily be the 3. And we'll talk a little bit more in depth about that one.
Also, the Commission for the Blind.
Right.
We started there. They told me about you, and that's why.
Great.
Oh, great. Okay. And there are some other waivers that might be appropriate. So the reason this is called the granddaddy or the Cadillac of it is because this is for people that are what the medical biz call NIFLOC, nursing facility level of care. That if these folks weren't in a nursing facility and they weren't supported by all these monies and these staff, they would not survive. That there are only 2 places because of the significant amount of their disability. These are folks that would not be safe navigating freely in the community for an extended period of time. And the waiting list, yeah, we have to always bring that up, is like 10 to 15 years. The last number we saw was it was at 10.4 years, but we've been inadequately funding it for a really long time. So they're about
qualify as a youngster, as a little one, and you don't become eligible until after that 18. That still doesn't disqualify you.
Right. Yeah. The disability has to have occurred, but when you get on the waiver, doesn't play into that. Good thing, because you know.
Yeah, the wait is long.
So here's how you apply. You have to call your regional office, and it's really important that you enroll with your region. And if you move, you have to move your place on the wait list because it takes about the same amount of time. If you move to a different county, you're on a different wait list. You're a different pot of money because the money comes and it's split up by county. So some regions, the shortest wait list, my last understanding was in Clovis, has the shortest wait list, but they also have next to no services out there. So you can get the waiver, but then you can't use it. And then you can't use it in Bernalillo. So you can't get the waiver there and then bring the person here for waiver services.
So where's Sandoval?
Sandoval County is Metro. So that would be the Metro number, yeah.
So the county's not listed on there, like Sephora?
I think that's Metro, yeah. It's not on there?
It's Valencia.
It's Valencia, so yeah, so Metro. Yeah. So you call, okay, and this is where it gets funny, but this is the part that we really talk people through, okay? So you call, and you're going to be completing what's called a MAD 325, right? They're not mad. They're the Medical Assistance Division. You might be mad. The reason they do it this way is it seems kind of like maybe counterproductive. Social workers used to be able to submit this. People used to be able to do this at Income Support Division. And guess what happened? They never got to DDSD. They never got there. So DDSD is the Developmental Disability Supports Division. So they're asking you to just call directly, do MAD 325. They have bilingual staffers at every one of these lines so that they can do your intake bilingual. They will complete a basic intake, a MAD 325, and they'll mark off PD waiver, and they'll put in your name and address, and then they'll mail you a wait list application. So you have to apply to wait to even get a shot at waiting. That MAD 325 is like proof of life. Frame it, put it in a waterproof, fireproof container, keep that because that is your effective date. And they allocate based on your MAD 325 date. Okay? So that's what they do. Then they're going to mail you a packet, and it's a copy of a copy of a copy of a copy. It's really faded, and I mean, it literally is a copy of a copy of a copy. I think it was first produced in 1985, and they've just been running off of the same one. But you will be getting that, and we're encouraging them to develop some more friendly formats, but that's what you get. Do you want to go ahead and go to the next one? Okay.
Before we leave.
Oh, yeah, let's go back. Let's go back. Okay. So let's talk about what you need to be on the waiver. So what they're looking for is in some conditions that are listed on the flyer that I'll give you guys, then you're looking for what you're looking for is an IQ of below 70 and significant impairment of at least 2 activities of daily living. So are they potty trained? Can they shower? Can they navigate between 2 places safely? Can they follow directions? Can they express to you what their needs are? Those are activities of daily living. That's what they're looking for, and that's what your documentation has to support. And that's what we coach families to do on their parent report to really kind of highlight, or the grandparents can even do. My grandson requires significant support when playing with other children on the playground because he will hurt them or himself or something like that. It can be one of those things. Here's the other thing that's true. Well, okay, IQ over 70, 3 ADLs. They have to have 3 ADLs, and that's also for everybody with autism. They have to show 3 ADLs regardless of their IQ for whatever reason. The documentation that we're seeing be the most successful is a combination of an IEP that the school has been responsible in articulating all of the ADLs because they know how to do it. The occupational therapist is talking about the functional limitations, the speech therapist, the teachers, the curriculum reflects functional limitation, and then a neuropsych evaluation. And really out of UNM are the ones where they're reporting, the reports are accurate and in the way that gets through. We are seeing, because of this influx for the population with autism, that families are going to private neuropsychologists. And the problem that we're having is they don't know how to write reports for SSI or for the DD waiver. And they're basically useless. And when the families are asking them to rewrite the report, they're not going to do it because they don't get paid to rewrite the report. Yes, Wendy?
And if you typically go for private, it's like you have to pay out of pocket. It's not something sometimes covered.
Right. So what Wendy said, who's our NICU staffer that's here, is that if you do go to a private, typically these are families that are paying out of pocket because the insurances aren't covering them. Now, the schools in New Mexico are not accepting the UNM neuropsych, the medical neuropsych, and so they want to do their own testing. So you really have to have both to cover yourself, and both will cover you on the SSI and the medically fragile waiver. But since there's an influx, we're looking at like 1 to 2 year wait lists at UNM.
For a neuropsych eval.
How do you get one? You have to have somebody, you do an order?
Your primary care physician has to make a referral.
And they would do that because you asked them to?
Yep.
And you're telling them you need that for the waiver?
For the waiver, for school, for SSI.
Oh, for SSI, okay.
All of it. You just need it.
Yeah, you just need it so that you know how best to help your son because they're going to partner child because they're going to a clear picture, hopefully,
right,
of like how your child functions in school, in work, in life, and the strengths and weaknesses.
Right, but if it's just for me, insurance won't pay for it. But if I say it's for SSI, then Presbyterian might.
Oh, I think your doctor, if you don't have a neuropsych, I mean, that's pretty standard for a person with an intellectual or developmental disability. My kiddo has to have a neuropsych evaluation because they do a whole battery of tests. And so if you haven't, then it's reasonable to ask for one.
Well, because I'm the guardian.
Okay.
I'm doing all the applications.
Okay. Right. Yeah, I think it's reasonable. I think it's reasonable because it's a really important key. It's required by everything, and you need to know as the guardian too, right? They do it's a whole day of testing to determine exactly what type of supports, and they make recommendations about what type of supports would be appropriate for the person depending on their age. Because people that get brain injuries, they have to do that. People that are new into epilepsy, they have to have neuropsych evaluation because it helps them kind of assess what the functional consequences of their illness or their condition are. And so it's a reasonable request at any time, really, if you have somebody with a developmental or intellectual disability.
Because Presbyterian has no neural, but staff, they would be.
And they'll make referral to the Center for
Development and
right, yeah, and then you go from there.
Although I've been referred out of state for some of those things as well.
If you're neuropsychiatric.
Yeah, that's the other thing.
My press.
You might be going on a little trip.
Right. So
Okay.
now, what happens once your child is on the D, if you've applied to the DD waiver, the child has been accepted, you've gotten your waiting list kind of thing, and then it just go into oblivion?
It's a really great question, and I'm really glad you asked that, and I really wish it was in here, so I'm hoping I'm writing it mentally. You wait, and what we talk about is waiver hygiene, and what we like to teach people about, right, is that the Developmental Disability Service Division has made no contact with anybody on the wait list for 7.5 years. So you have no idea where you are on the list. So when we get new staffers, one of the first things we do is we say, let's call and find out where you are on the wait list. And when I first started working here 6 years ago, they did that to me, and it turned out I wasn't anywhere on it. My kiddo wasn't anywhere on it, and I had already been 6 months waiting on it because it just never got completed. So we recommend that you call every 6 months to a year. They have staff changes, they have file catastrophes, they have all sorts of stuff, and it's just imperative to find out who your case manager is. Are they still employed there? Is your child, have them read to you all the contact information, because there's another waiver we're going to talk about that we were on, and they had miskeyed our address and our phone number. So we didn't get any of the letters of allocation or any of the phone calls. It just so happened that a professional friend of mine worked in the same department as that, and they were talking about this lady's going to lose this waiver, and said my name, which is inappropriate, but it was beautiful that it all worked out and we got our waiver. I mean, it was legitimately. So checking all of that every 6 months to a year and finding out, because so here's another part down the rabbit hole. If a kid is under 8 and 9, they will go into pending status, because you cannot determine an intellectual or developmental disability definitively until they're 9. They just won't do it. And so they put kiddos under the age of 9 in a suspension pool, in pending status. And they sometimes reach out to you, but it is your responsibility as the guardian parent to provide them and contact them when you're in that range. That means you also have to be making sure that you have the appropriate neuropsych evaluation, and you need to be working with the school to make sure that they're doing the testing and documenting it in the IEP so that the IEP is ready to go at 8 or 9. It's not to get the allocation, it's just to move into what's called start status. And start status means that they're probably going to be eligible once they go into the full allocation, okay? So then at 8, 9, then they can move out of the suspension pool into start status. They still get that very first date that's on the MAT 325 as long as you've met all of your deadlines. That they go into start status, and then they just sit there and probably get no contact until one day you get a letter that says, you are up for an allocation to the waiver. Now complete this 60-page evaluation document so that we can absolutely, unequivocally determine that your child, so this little guy, this 15-page thing that you're going to get onto the wait list is a precursor and a planner for what you're going to do in 10 to 15 years when you get the 60-page document that can take months. And then you build your plan and you pick your agency, or if you're going to do self-directed. And but we have another book and another training just for that. But we don't do a lot of that because they allocate maybe 100 a year.
Do you know where they are now?
They are in April of 05, I think. 07? I feel like they're in April of 07.
Last week they said it was May.
2005? Yeah.
And
Those are the kids that they're pulling onto the waiver, May of
That's what they
2005.
say. It was like, what, last?
That's when they submitted their application.
Yeah, so people that completed their MAD 325 on May of 2005 are getting notified now that they might have a slot available.
That was two requirements on time. Are they equal in Germany? One doesn't have more. Well,
Wait,
the
then
reason
the-
I'm asking financial criteria, we have a son who's post-transplant, and it will require $10,000 worth of medicine every year for the rest of his life,
Mhm.
which might be a little bit more than most.
It has to be Medicaid financially eligible, so the income support, the same way that they do the eligibility for SSI or for Medicaid, it's the same way that they determine
Okay,
it.
because he has that
So it's the
Well, he
same.
has that for now.
for now.
It's pretty much the same way. There's assets and all of that they determine, but they're not going to look at. I don't think they're going to look at what you're spending your money on necessarily. That's your question. So, any questions on this one? So,
Well, I do have something that maybe you're going to answer later,
Okay.
but generally, I've heard some ranges of what the.
Because it pays a range. Yeah. it pays a range, and it actually,
70, those low, I mean, or can they go lower?
I think it's 15 is the lowest. Yeah, so they have, because they introduced a new tier system, it's A through H, I think. And so H is the highest, the Jackson class members, and that's a really big story that I can't get into, but there's a certain population of people that get, that were in an institution and were abused, and then we closed it, and part of the settlement is that they get really more than everybody else. They get really well taken care of. And then from there, it goes down like in $15,000 blocks all the way down. And so there's controversy on that because we use a tool that is viewed by some called the SIS, support intensity scale, that some feel is inappropriate for determining that. But the care team, the family, and their rights to appeal the SIS and all that they've made it a much more well-rounded picture of the individual to determine that money. Because $15,000 in the life of community support can mean a lot. But yeah, so they can get an A through an H are the categories. So, so it really does vary. Now, if a person chooses the self-directed option, which I'm not going to go into depth, the self-directed option, those budgets are a lot smaller because they have almost no administration. So they tend to be between like 33 and 75,000. Because you're not paying for the case manager and all the administrative stuff because you're doing that yourself. But the benefit is that you get the flexibility of you can pay your, you can't pay you can pay yourself community direct support to care for the person, or I can pay my mom, or, there's a little bit more flexibility. Like if I can make the argument that a kayak would really contribute to a person being a member of the community and a part of their business. Well, you wouldn't want to do business because that'd be DVR, adaptive kayaking, then a self-directed waiver could do that, and a traditional waiver would.
On the A through H categories,
Uh-huh.
are they published anywhere where you can see they?
Are you going to answer that, or you have another question?
Well, I'm gonna answer too.
Okay.
How they're gonna measure this, and when you do this, I won't go too much into it, but when you do this, what I would encourage you as a person who's done 12 of them, or been a part of a lot of them, is that when you do this, you want to do it with yourself, with the individual with a disability, and a friend.
A friend.
Like, I'll use my friend Corey, for example, that knows you really well. At least for a year, they require a year or just about, because when you go into that list, they're going to look at you and they're going to say, okay, Adam, well, can you use your cell phone? Well, yes, but hold, you don't want to answer yes totally, because what does it take for me to be able to use myself. So it takes courage that a court can you dilution, can you put in my head? Also, yes, I can use it, but you have to think what it's gonna take to get you to the point of being able to use it. And those are the types of questions that they're really gonna ask you. So I encourage you to be really diligent while you whatever parent want to make their child, want to brag about their child, and that's great. That's all fun and dandy. At the same time, we all have to be realistic in order for them to get the services they need, and that's what I would encourage. And the other thing I was gonna say is that, we know talking about her daughter wanting to get a job and buying all this stuff is that when you do become an adult and you say, all right, like me for example, I'm gonna get a job at a firm. Well, that's cool, but I encourage you to be in tune with her, like Naomi, for example. I encourage you to be in tune with the person who actually hires you, because you need to communicate with that person. Oh, okay, Naomi, because I make this certain amount, I can only work 75, and then you kind of come up with a schedule. But again, you have to be really diligent, because if you go over that 21.99, then there could be some trouble. So you have to really, and I encourage you to use people around you and encourage your kids to build a good support system, whether it be a job coach, whether it be coworkers, whoever, to say, okay, realistically, what can I do to be a productive member of society?
Great. Yeah, and so for the people on the phone, just to kind of reiterate what Adam was saying is, and I think it's a good reminder, because I think as a parent, sometimes we think that we're kind of in this on our own, or we're just surrounded by providers, and we think about which providers can we bring the documentation from. But what we've talked about on all of these is that there's an option for families and friends to also participate. SSI has the option for a statement from family and friends. The waiver has the option for statement from family and friends. And what Adam is saying is that he's had success and watching other people with the CIS of these planning meetings of having people outside of the family and the individual also coming, because they might have other feedback. Because we might kind of, again, we get, we're having to talk in a deficit system, and that's really painful for families sometimes. And so we would say, yeah, of course, Adam can use the phone. And Corey would say, well, but I have to get it out and put it in front of him, or else he misses the call because he's trying to get it out of his bag, or something of that sort. And so the more the merrier, and people that know you outside of the adversarial, which I think is a beautiful thing that we fight with our parents. But getting outside of the maybe what could possibly be different values in the individual and their guardian or their parent, to have a third party who's a friend and is just interested in the person and how they interact with the community. So those are all really great suggestions. And then looking at the aspect of having to communicate with an employer, and that's something that can also be done with DVR to make sure that a person doesn't exceed their employment, doesn't do the type of employment that winds up there might be a type of job where they could earn so much that they wouldn't need this waiver, but they probably can't. They'd have to make like $150,000 a year. or more to fund what they can have the support with the waiver. And what's not in this slide, this really gets important when the individuals are getting out of high school, because a lot of this stuff is going to get taken care of by schools. But you know, what we really worry about is the individuals that don't get on this wait list early, and it's why people kind of scare people, I think, when they have younger children, is because we still get phone calls regularly of people with 22-year-olds who are getting ready to get a certificate of attendance because they don't get a diploma, but getting exited out of school and they have no plan and they can't access adult services because they can't afford them, and they have to have a waiver to pay for them and to access those, and there are wait lists, and or there are none, or there are ones that are questionable in their standards or what they offer, and they're looking at a 10 to 15-year wait list before that. So it's what we call the school to the couch pipeline. These kids wind up going from being in school supported to sitting in someone's waiting room.
This is support
Intensity scale.
intensity scale.
And the Center for Development and Disability, it's cdd.unm.edu/infonet has a tip sheet on the SIS, so it specifically will talk to you about what the SIS is, what we can talk about, because it's also involved in litigation called the Waldrop case. So
This is in the state of my.
Have you had any experience with people who are homeschooling their kids?
yes, and Gala can talk about that, but the problem that we run into is they don't have the amount and the type of documentation necessary to get this. And when they are up for the waiver, then at that point, then they're getting on these 2-year wait lists to get their neuropsych evaluations. They don't have the documentation because
So if we've done all that, that will help a lot.
it depends on how long back, but the neuropsych will help, but it's not the only thing. Then you would have to get statements from therapists that worked with them probably, because the IEP gives you that. It gives you all of how their learning is impaired because of how their curriculum is modified. Now, Gala, you said something about where they can get an IEP for homeschooling or something like that, right?
Evaluation.
Okay.
Yeah, different from your local school district. You just have to request an evaluation, whether you go to a private school or you're homeschooled. Your local school district has a person who can do the evaluation, and that's what you need. The evaluation information.
Because we have a yearly meeting where all therapists, everybody involved in his life come. It's not as descriptive as the IEP, but
And not even an IEP, but an educational evaluation versus a medical evaluation.
So you need both of
to have
those.
both, you can still access those through whoever your local school district is. You just have to request in writing an educational evaluation. And the staff here, Melissa and Gala are two of the staff who work with you, but we have several others who work specifically within the education area.
To help you figure out where to do that.
Yeah.
These are all really great questions. But this gets really important when they're out of school, and it could be like getting an apartment, getting a job, just navigating freely. It can cover a lot. So my sister-in-law, my in-laws did everything by the book, but somehow they forgot to tell them about the DD waiver. And so my sister-in-law went on the wait list when she was, I think she was like 15, and she got it at 26. So she had that 4-year period of literally just sitting in the waiting room of my father-in-law's shop, and sometimes getting to take the bus to see some friends and stuff, but it was not great. And then once she got it, she lives in a supported apartment community where she has her own apartment, her own kitchen, but the community has full-time staff, like 24-hour staff, and some people do have a staffer in their home with them. She has transportation, she has the job of her dreams and a fiance. They're not getting married because they don't want to mess their benefits up, but maybe a private, church ceremony, something like that. But all of that is a result of having the waiver and how different the supports were. So, okay. So can we move to medically fragile? So medically fragile, now this one confuses people, but this also has a medical and financial. So the medical and the financial is clear. It's the same as for, it's just based on the individual. So this is likely going to be a child. This wait list is much, much shorter. It's about 6 months to a year. And that's because kiddos on this tend to have much, much shorter life expectancies, even outside of the hospital. These are kiddos that have, really significant, typically seizures, feeding tube, technology. Other states call these a technology waiver. And they, what's interesting is they must have a developmental disability. And we didn't really know that until we started kind of teaching about this. But it's very rare for a child to be medically fragile and not have a significant developmental disability. But from time to time, there is a 9-year-old that when they run through and do the reevaluation is not having a developmental disability significant enough, and they fall off of this waiver. So it's something to keep in mind.
And just because we happen to be the fiscal administrator for this waiver in the state of New Mexico, but a child is eligible for up to $1,000 for 1 year cycle. It's typically used to purchase equipment or other support resources for their living situation. So it could be a certain kind of bed or a certain piece of technology that would enhance their quality of life. So it's typically up to $1,000 per 1 year medically.
Yep. And so the difference between these waivers, and sometimes you can be on the medically fragile waiver and still be on the wait list for the DD waiver. And what you would do is just move over. And some families are really fearful about moving from medically fragile over to DD waiver, but DD waiver has those community direct supports. Really medically fragile is a technology and a skilled nursing and some respite. That's what it's intended for. This is keeping people alive and in the community. That's the bulk of what the benefits are. DD waiver has all of that and job, housing, community engagement, all of that. So it behooves people, most people will move from medically fragile over to DD waiver. You can't have them both at the same time, but you can be on a wait list and just move over. We used to have a third waiver, which I'm going to talk about its new kind of world that it's living in. Well, do I not have it on here? Yes, I do later on. But it used to be that you started on like medically fragile and then you could go to, or you either start on medically fragile or you started on disabled and elderly. And it was kind of like a stopgap because it's smaller. The medically fragile waivers, the budgets are much, much higher because of the technology and the healthcare costs, but the menu of benefits is lower. So
Now,
go ahead.
the medically fragile waiver, how long can you be on that?
You can be on that your whole life.
You can. Okay.
But most people go on the wait list for both, and when they come up for the DD waiver, they move on to the DD waiver. Because the DD waiver has everything that the medically fragile waiver has, and then this whole other batch of things.
Really should apply.
Yeah, you should apply for both.
Because that'll hold you over until 12, 14 years comes out.
Yeah, and when they do your intake, the same thing, medically fragile waiver, you call this number and you do the intake, and they'll pretty much tell you if you don't qualify at that point.
We just did one last week.
Yeah.
Okay.
Yep. So medically fragile is really great for the kiddos that it is. Now, the only options, there is this Me-Via waiver called My Way, and it's a self-directed option. So on medically fragile, on a DD waiver, you can choose the Me-Via option. It does not have a case manager, but you do get a consultant. We've been on my kiddo has been on a self-directed option for about 4 years now, and there's some really positive things and there's some really negative things. I found out that I'm completely, organizationally impaired. I cannot complete time cards accurately and turn them in at the right time, no matter what I do. I've tried.
If you do.
Even if I know,
Let
even
me
if you
say,
do. Yeah,
I have
exactly.
2 kids on
Yeah,
the DD
exactly. And so what I have to do is I have to build into my budget where I have to pay the person that's my respite provider the time to do that stuff, where they have to fill it out and then we sign it and then they help us submit it, because that's how it was very humbling, because I have a master's degree and I think I'm kind of smart, but there are some things that I cannot do. I cannot circle every AM and then PM, and if you don't, then you find out 2 weeks later that your person isn't going to get paid for another 2 weeks. It's just
And again, you're keeping good records. Our daughter's waiting 6 months to get
yeah,
Is that risk?
right.
one through three.
So it's gnarly. So there's some really beautiful things about it.
And it is a good waiver.
It
really
is a good waiver,
But
yeah.
since they've gone to Follis, it's been a nightmare.
Has it? Yeah.
Oh, it's been a nightmare.
Yeah. So, so there really aren't any easy options. This again, if anybody thinks that people are being, getting on the dole and getting to do all this easy stuff, they've never actually tried to use it. A lot of times, families that get the BD waiver have to quit working the first year, even if they get not the self-directed option, or if they do the self-directed option, just to be able to get. It takes a full year to find and get into all of the services. So the first year of trying to get into all of these and find the providers and moving and all that stuff, it's, I know a lot of families that have had to, one parent has had to quit working for that first year to get the kiddo set up and all of their services. And these are the numbers for the Mevia. If you have questions, they have 2 numbers. They like to just answer the phone directly. I think Regina and Christine are the 2 people, and they're pretty helpful. We're trying to encourage more people to do media because they are smaller budgets, and then that makes more money for more people to be allocated. But if it's not right for everybody, it's just not right for everybody. You can move back and forth, but you can't do it a bunch. But let's say you go over to media for 60 days and you hate it, then you can move back to traditional. I think it's a really good idea to try to time it around a new budget, though, instead of doing it in the middle. Just because it's just kind of scary. Because if you're agency based with your waiver and you decide that you don't like your agency and you try to move, all of your money stays with that agency, all of your respite dollars. So.
And you're sure about the medically fragile lasting all for a lifetime? Because we've been told, to apply for the aging.
Yeah, that's what I'm talking about right now.
Has a TV, but
Yeah.
that all of these smaller waivers, like the brain injury waiver.
That doesn't exist anymore.
Right, that it's all being.
And that's what we're talking about right now. Yep. So then the third one that we don't talk about very much because we couldn't find it. It used to be disabled and elderly. It took us like 3 months to find it. It disappeared when we got Centennial Care. It used to be called the disabled and elderly. Then it became the Colt C, which is really friendly. Coordination of Long-Term Services Medicaid Part C waiver is what they changed the name to. It doesn't exist anymore, so don't worry about it. But then it disappeared when we had Centennial Care, and so we had to go to meetings and ask and ask and ask. So what it is called now, and this is what gets really confusing. The DD waiver and the medically fragile waiver are what are called 1915 waivers. Medicaid Part C waivers. They're called 1915 waivers. But when we did the Affordable Care expansion, we purchased something called an 1115 waiver, which is Centennial Care. So it throws off all of our waiver conversations because it's like it, but it's not. So the Traumatic Brain Injury Trust, the D&E Colt C waiver, the HIV/AIDS waiver, those were all 1915 waivers. But when we purchased the 1115 waiver, we absorbed those 1915 into the 1115 waiver. So they went away and they all went under Centennial Care. Those guys got grandfathered in. So when they were in 1915, they could waive the parent or the caregiver's income, and they were for elderly, disabled, traumatic brain injury, HIV/AIDS. Those people got grandfathered in. Anybody else on that wait list falls under income support standards now. So, but they kept 2,000 slots that would just be based on the individual with a significant disability or that was aging, and they named it the Centennial Care Waiver for Community Benefit. So this is the only place that if you have a person that has significant disability that doesn't qualify for DD waiver, that doesn't qualify for medically fragile, or may in 10 to 15 years, that you can apply for this and it will waive your income and base it on the individual. So that's what this is for. If you can get Medicaid through income support division for your person, then just do that because they get the same benefit. It's just another door in. So if you earn too much or they're not eligible for those other waivers or there's a wait list, this is just one more place.
And they don't have to.
They could be anything. So this is really for people who have a spinal cord injury. This is for our kids. Gobble these up. Our kids with significant intellectual disabilities that are on the DD waiver waitlist. Very patriotic. Because when you call in, they do a score. They do a phone interview and they give you a score. And those of us that have kids that qualify for the DD waiver, we smoke everybody else out. We land on the emergency status. And that's part of what happened to the waiver, is what happened to that wait list and everything, is that our kids got onto this 10 to 15 year wait list. We all moved over to D&E and we gobbled up all of those slots. So, but it could be for people who are blind or visually impaired and do not have a significant enough developmental disability or health care to go on those. I recommend that everybody applies for all three if they have a medically complicated kid, or DD and this one. This one's funny because we suspect that there are 14,000 people on this wait list. DD waiver is 6,000. It's a much smaller waiver. It's max 16,000. For children under 18 now, they're really only letting you access about 1,300 of it. They're just
$1,300 spots or $1,300?
dollars.
Oh.
And it all has to be used for respite, which is like 100 hours of respite per year. And so, but it is there. And so what you do is you call that 1-800 number that's on there, and you have to select option number 2. If you select any other option, they have no idea what you're talking about. We've had this experience. This is Aging and Long-Term Services. They house the wait list for this. They fund it intermittently. We never know when they're going to fund it. You just get a letter in the mail, hopefully, because your address is correct and your phone number, and then you get it. And what it does, the main thing that it does is it gives you Medicaid based on the child's income and not yours, and that's it. So that's the benefit of it.
Medicaid and $100
For kids under 18.
only on.
Yeah, it's up to $16,000 budget for kids over 18. And they can use it on environmental modification. They can use it, if they do the self-directed option, they can do it for purchasing a computer. There's housekeeping. Have a housekeeper come in for kids over 18. So
Under 18, if they're already on the Medicaid, can they still get the rest of the money?
yeah,
Okay.
yeah. They have to be in the community benefit though, so they have to have a care coordinator if they're under 18. Is that what you're saying? They're under 18? Yeah. So you would need, if you haven't already done your health risk assessment, then you would call your member services, you would complete a health risk assessment, and then if they score, I believe, a 2 or 3, then they get bumped into care coordination, or you can request an evaluation for care coordination. Then a care coordinator will make contact and they will complete what's called a comprehensive needs assessment. They'll come to your home and they'll do a full kind of ask you the questions. And again, we want you to be honest, but we want you to remember that this is a deficit-based system, right? This isn't time to show all little Timmy's trophies. This is to talk about what it looks like on little Timmy's worst day when you're trying to cook and the kids are killing each other and he has a seizure and your husband's, you know, traveling and, you know, and you just had a fight with your mom and, you know, what does it look like on the worst day? How much support do you need is really what we're kind of looking for. And then they'll assess kind of a budget and they'll help you kind of build what services you need. And then we'll have the workshop next week on Centennial Care, just specifically if you want to do more of that. People on the phone, if you have any questions, now would be a good time. You can *6 to unmute yourself. All of our online people, I think, got kicked off, and they didn't come back on. Oh, a bunch of people on? Okay.
I just want to mention that if people aren't aware, and this wasn't covered today, but there are services available through the Department of Vocational Rehabilitation starting at age 14 as well. So to just keep those in mind, that are also income-based. And my understanding is they're still ramping up their employment in order to provide those federally mandated services, but that the more people who come asking for them, hopefully the more we'll be able to actually access those services. Wendy has something to say about that.
And it is for long-term employment. And so as soon as they do turn 14, if you're not looking for them to obtain long-term employment at that time, it's best to maybe just make contact with them, but you don't have to go through the whole process. But when you are looking at, hey, maybe they're going to graduate in 6 months, and what will they do? So it's always best to try to pre-plan that and get in contact with them early so that they can look at supporting you, getting the training, looking at seeing what supports they can provide so that that individual upon graduation can maybe move into other jobs. But it is a long-term process, but then once they get you set up, then they hope to go over, like set them up in employment.
Give you job.
Right. So, and the training. And then I would just recommend as well, something that they don't necessarily cover is that when you're typically developing a child, you're going to want to, as they're going through their middle school years and high school years, you're always probably thinking about like, what should they be doing? What do they want to do? What are their likes and interests? And so you're probably getting them engaged in volunteering or things like that and asking those questions. I think questions should be asked even as the child that has the disability and try to hone in on what their strengths and weaknesses are so that you can help to give them those soft skills of volunteering and really exploring their life and things like that. Even though they're 14 doesn't mean that they still can't go on movie and things like that. So those soft skills are going to be really, really important to be able to help identify and help people and help SSI and help the DD waiver people be able to identify what is it that this individual wants long term. Because they're not going to be able to, you may not necessarily be able to answer that too, but it's a full picture sort of painting that you're creating. So always keep that in mind as they do turn 14, get in contact with them, but also look at providing them those opportunities to obtain the soft skills of what they like to do or find out what they don't like to do.
And Melissa had a question.
Yeah, I had a parent asking. It was actually around like the income, whatever, about applying for things. One was if the child, if we were talking about how they're getting married or whatever, the income is not doubled. If the child is not, say, like the mom or the dad's that they're getting married to, does that income still count?
Yes.
Yes, they do. Okay. And two, child support. If you have more than one child, if you're getting child support, then to be prorated for just that one child.
I don't think so. It's all income coming in.
Okay.
Yeah.
So it's all of it. Okay.
Did you have a question, Adam?
More a comment.
Oh, big surprise. No, just kidding.
It goes with what Wendy said, it's funny enough. I actually did this yesterday for myself, and it's good information. So let's say in the beginning of your employment, you use DVR, you may be using the waiver now, but let's say now you need a piece of equipment, right? So, what if it's been a while, but they still may have you on file, what they're gonna ask you to do is go back, do their orientation, and then what those deem as if you need a piece of equipment, and I hate this wording, but if you don't have this piece of equipment to do your job, then you won't lose your job. And that's how they determine whether or not they will eventually help you purchase whatever equipment you need. typically, that is something, you might think, oh, well, I already used it. Well, you can use them again later on. It's just in a different capacity.
You can wait, yes, you can go back and forth with CR, and they will provide, just like Adam saying, that they can provide that technical support for the individual to be able to be able to have a job and do their job, and things like that. The caveat for those 14 to 18 years of age is DVR takes it based upon the family income, so that's not waived. So if you show that have some money, then they're going to take that all into account, and they might say, okay, this is how much you have to contribute to be able to provide this service, or provide counseling services, or job coaching, or whatever it is. They might present you with a bill as a parent that has a little bit of meaning, but not necessarily. What is it? So I believe it goes by the individual.
Free next week, are we ready to be here?
And I'll put you on the list.
Yeah,
Maybe we just had an idea last week. Okay, so we're having lots of other side conversations. Sorry, so I have still 15 people online. If you guys have any questions, my name is Lisa, and you can contact me at 505-247-0192. For any of you guys on the phone or on the computer, thank you for joining us. If you talk to people that got kicked out during the program, it happened to a bunch of us, and you just have to kind of pause and try back later for future training. We will have a Centennial Care workshop next week, and I will send out the invitation in similar ways. If you would like to provide feedback, you can also contact myself. You can email me at lrosignol. That's L as in Lisa, R-O-S as in Sam, S as in Sam, I-G-N-O-L @parentsreachingout.org. And I would prefer nice things. You don't have to, especially not any super mean things. And if you have any questions, I'll be hanging out for a few minutes. You can *6 to unmute and ask questions. And thanks again for joining us.
Thank you. Most helpful.
Before you go,
Oh, do you like it? Oh,
I'm a student family, so
No.
he's a cowboy fan. I'm working on it.
No. Hey,
He has a cowboy
I
man.
work with a Cowboys fan, and they're always on me.
I know I hate when he makes me get it out.
Catherine Brown is our person that we love. She says, we're not responsible that we get
Thank
our Catherine Brown, she's my favorite.
It's a great daughter as well. But I'm answering these questions on behalf of a bunch of parents.
And I'm in denial because I have a 9-year-old, so I should be looking at that, but I'm like, I'm waiting till 14 because I'm not quite ready for it.